Opening up the waiting room now. And we will just let people join for the next little bit here. Thanks for coming this early.
Just gonna grab a drink. I'll be back.
Thanks, Cass. Thanks to everybody who's joining. We're going to give it a few more minutes and officially start at 4:40, but we might do a couple things right before that at start time. So thanks for joining, and we'll just hang out for a little bit. There's the official countdown clock. Thanks, Cass. Well, good morning, everybody, and thanks for joining us so early today. We have lots of people kind of that's building here in the participants. I know that the numbers that you're seeing are not representative of the number of rooms and people in rooms that are that have gathered this morning. So thanks so much for joining us at this wee hour. We're officially getting started at 4:40. We're going to give participants a few more minutes to join. But while we're waiting, if you want to take a peek at the chat, we've added a couple links in there for ways that you can continue to celebrate and share your experience this week, including the Sharing the Love website and our Connect Care Zoom backgrounds. So just check those links out for some details. And then we're going to officially get started at 4:40 this morning. While others continue to join, though, we do have a Menti poll that we actually just a little activity that we wanted to see how that works. We want to make sure our systems are working personally and technically. So I'm just going to turn it over to my colleague Janine to walk us through just that interactive process.
Awesome. Thanks, Catherine. Good morning, everyone. You can either scan this QR code that's on the screen with your smartphones, or you can go to menti.com. And excuse me, when you open menti.com, type in the code 97569080. Hopefully you can see that at the top of the screen. And we will launch into our word cloud. We want to ask you, what are you looking forward to most as Connect Care is launched across the province? So again, it's menti.com with the code 97569080. And we'll watch and see the word cloud develop together. Seeing some really great ideas in here: improve patient care, access to data, transparency is another good one. As you can see, the more a word gets submitted, the larger it appears on the screen in the word cloud. And each of you can submit up to 3 words. So if you're looking forward to more than one thing, you can definitely enter that into this app. I love that someone put another launch. A brave soul at 4:30 in the morning.
I'm sure everyone will get right on that, Ginny.
And since there's lots of entries around things like data and information, you can see on the bottom right of the screen that we've had 16 people enter into this word cloud. So, and improved patient care seems to be standing out as the #1. We'll give it a couple more minutes. Is that okay, Catherine?
Yeah, let's give it about a minute and then we'll have we'll get things kicked off. But this is great. It's looking really good.
Yeah.
I do love that improved patient care is that #1 message there.
Mm-hmm. And while we'll take it off the screen, we'll keep it open so people can still enter, and I'll put the information into the chat and people can continue to enter, and we will save this word cloud and share it out after the launch.
All right, well, thank you, Janine. And with that, we will welcome everybody officially to the event. Thank you again for joining us for this today. It's a major milestone in Alberta's health history again. My name is Catherine Cranenberg, and I'm leading the Connect Care communications work with my colleagues across the community engagement and communications team. Behind the scenes today are Cass Raffi, our Senior Provincial Director of Innovation and Digital Solutions. And you've already met Janine Sakic, Executive Director of our Community Engagement team, and Heidi Harris-Jensen, who's one of our Connect Care communications leads. So just give a wave, launch event team. I know they've been up and working, so thanks so much. We have a really quick agenda that's up on your screen, or will be shortly. That we're going to jump into. But just before we do that, I do want to recognize that across many parts of the province, our staff are supporting one another, their sites, patients, and families as they deal with the wildfires and that evolving situation. I know lots of people have been up long hours, so our thoughts are with them this morning, and we're praying for rain today. Given the work that's been done, it remains important, as you know, that we continue to move forward with Launch 6, and we don't want to lose sight of the importance of that project and all the value that this will bring to Albertans. Across our zones and sites, our leaders have been working alongside teams to ensure you are ready for launch and safe today. This morning, we have many AHS executive zone and program leaders on the call, including AHS President and CEO Mauro Kias. And we also want to welcome Rosa Rudelich, Chief Operating Officer for Covenant Health. Thank you all for being here today, and feel free to give us a wave and a hello. Thank you for the support you're providing to teams and for joining us this morning, everybody. Before we get to the rest of our agenda, I do also want to pause and acknowledge the lands on which we work and live. We acknowledge that we are gathered virtually today on the territories of Treaty 6, Treaty 7, and Treaty 8, and Métis regions 1 through 6. These territories are home to many Indigenous peoples, including the Blackfoot, Cree, Dene, Saulteaux, Ojibwe, Stoney Nakoda Sioux, and Tsuut'ina people, the Métis nations of Alberta, and the 8 Métis settlements. We acknowledge and respect the treaties that were made on these territories, and we acknowledge the traumatic and painful impact of colonization on Indigenous peoples. And we recognize that eliminating racism in healthcare is a crucial step on the path toward reconciliation. We dedicate ourselves to a collaborative partnership with Indigenous communities guided by patience, understanding, and a commitment to reconciliation. Well, we are so excited to have so many sites and programs launching today with AHS and also with our partners at Covenant Health and Care West. Many of you have gathered at your sites to recognize today in your own ways, and thanks for joining this launch, the virtual launch as well. If you want to see your colleagues, just make sure your settings are on the gallery view and not the speaker view, and then you'll get a sense of everybody that's on the call. You can, and I think Janine's going to unmute us for a second, and you can give a little wave and a cheer from your home site. So go ahead and show us how excited you are to make this happen this morning. We're going to listen to you for a second.
Do I have it? Your video.
Yay! Quiet teams out there.
Woohoo!
Yay, woohoo.
Thank you.
Woo!
Awesome. Okay. Well, as we saw in the word cloud that we did just before we officially got started, we know that there's some excitement today, even though you're a little quiet, but those who have launched before you would say it's normal to have some excitement and probably also some anxiety and nervousness. Our launch 1, 2, 3, 4, and 5 teams have already been through this, and they know how hard you've prepared for this moment. We have a few messages from some of your colleagues who have already launched and want to encourage you as you start to use Connect Care daily. So I'm going to ask Cass to play our video from those team members.
I think Connect Care has increased our ability to collaborate in terms of patient care, and I really look forward to moving from implementation to optimization.
I really like how easy it is to communicate with the other staff that are involved with the patient. So there's like the secure chat feature, but it also just makes it really easy to find who is on their care team.
My favorite aspect about Connect Care is not having to chase around doing the previous non-clinical tedious tasks we used to do. along with the ability to access information, both past and present, and one place has been the ability to access the resources that we need to do our job. It's all really well laid out in Connect Care and easy to find, which has been great.
It enables me to provide better patient care, more consistent patient care with that information more at my fingertips.
My advice would be just make sure that you ask all your questions, no matter how big or how small. You're not going to get in trouble. They're there to help you, right?
I think the most important thing is to ask for help. There are lots of people around in terms of super users, resources online.
Working as a team and just keeping your focus that deep down I do know what I'm doing, and we will get through this and it'll become second habit soon enough.
It really is an encouraging thing to see everyone working together towards the same goal.
I think, just work through it, take things slow, seek to find the how-to, and really know it, because once you've done it once or twice, it becomes so easy in the long run.
For those sites that are launching, I would say just try to be patient with yourself and not have the same expectations that you maybe did pre-launch. You might find that you go in to do something, to go give a med, and the first time you do it with Connect Care with a rover in your hand, you don't feel like you know how to give a med, and that's okay, because it will come, but you just have to be patient with yourself, patient with your team, and recognize that we're all learning.
Know who your experts are, know who your super users, trainers, like IT support analysts, know where to go or know the phone call you need to make, and do it early and often.
My biggest word of wisdom will be just breathe and be patient. You'll get it. You got this.
Thank you so much to our colleagues for sharing their wisdom, experience, and most of all, your support. Well, as you know, patients are at the very heart of Connect Care. We saw that improved patient message in the word cloud we started. And today we have a really special guest with us. Charlotte Kessler is joining us from her home in Medicine Hat and has graciously agreed to be part of our launch event today to share her story and experience. And as Charlotte has explained to us before, Connect Care, and in particular, MyHS Connect, the patient portal, has enabled her to be more directly involved in managing her own health. So Charlotte, I know you're with us this morning. Go ahead and share with us your thoughts, and welcome this morning.
I just want to start with saying I'm so excited for you all to be the ones to go live with Launch 6 of Connect Care. I've been involved with Connect Care as a patient advisor since before their very first direction setting sessions. And I've consistently been so impressed with how thoughtful and attentive everyone has been to do their very best to ensure that all the users of Connect Care, from physicians to nurses, techs, admins, and so much more, would see benefits to their work lives once launch occurred. To me, the piece of work that really put this system over the top was how much the same commitment was made to us patients. The AHS portal and MyHS Connect truly have been designed with us at the center of it, with us hand in hand, step by step. As a brain cancer patient, I had to be patient and didn't get my own access to MyHS Connect until the past launch in November 2022. Let me tell you, it was worth the wait. I've already experienced so many of its benefits, and I have not been disappointed. I've been able to review and update my medications, history, appointments, been able to communicate with my care team. I've been able to review my after visit summaries and have what my care teams and my next step needed to be right there in my portal. My favorite part so far has been when this past February, while I was on vacation with my family, I had an episode of loss of sensation on my left side a few days after my latest MRI. This was very scary, as this could be a sign of recurrence of my type of tumor. Luckily, my MRI results were available on MyHS Connect when I got home, and I could see that my scan was stable and there was no change to my tumor. I was able to drive from Medicine Hat to Calgary for my checkup with my care team a few days later without the stress and anxiety of not knowing what I would learn at my appointment. If there had been change, I would have been able to process this and prepare for this appointment with my family. I'd have been able to ensure that my husband could travel with me and that our daughter would be taken care of at home. On top of seeing my results and not having to wait anxiously, I was able to complete my symptom report online at home before my appointment. I was able to share with my team ahead of time what had happened. When I got to my appointment, we were able to dive right into what likely had caused my episode and how to move forward. My team had even been able to prepare for me in advance some supports and resources. Talk about Connect Care being a great benefit to us all. I know you'll all feel the same very soon. Thank you.
Thank you so much for sharing your story, Charlotte. It's a great reminder that everything we do is to improve care for our patients, and we value that you joined us this morning to share that and why it's so important. So thanks so much. We know that every Connect Care launch is unique. While you're in every zone in Alberta, distance, a pandemic, and yes, now wildfires have not stopped you from working together to prepare for Launch 6. We have a little video that we want to share to celebrate some of what makes Launch 6 unique. So over to you again, Cass. Thank you.
Teams across Alberta Health Services and our partners have continued to build bridges and improve patient care as they prepare for their turn to join the Connect Care family. Welcome Launch 6. We are excited to have you. With every Connect Care launch, we bring more frontline healthcare workers, physicians, and patients together to improve care in every corner of Alberta. Launch 6 takes place on the Treaty 6, 7, and 8 territories and Métis regions 1 through 6 and includes all 5 zones across Alberta. Calgary Zone is launching 33 sites, including the Rocky View General Hospital, South Health Campus, and the first Care West Clinic. In this launch, all remaining lab services provided by Alberta Precision Laboratories and DynaLife will launch across the Calgary Zone, so all of Calgary's labs are on Connect Care. Central Zone is launching Connect Care at 23 sites in 13 different cities, towns, and villages, including continuing care facilities across the eastern parts of Central Zone. The Lamont Healthcare Centre and 4 Covenant Health sites, St. Mary's Hospital in Camrose, St. Joseph's General Hospital in Vegreville, the Killam Healthcare Centre and Mary Immaculate Care Centre in Mundare are also launching Connect Care. North and South Zones both have sites launching, with Grand Prairie EMS and Peace River EMS in North Zone and Medicine Hat Station and Lethbridge Station in South Zone. Edmonton Zone is launching Connect Care at 6 sites, including the Alberta Hospital Edmonton and 3 Covenant Health sites, Grey Nuns Community Hospital, Misericordia Community Hospital, and Villa Caritas. With this launch, Addiction and Mental Health Services in Calgary Zone and Central Zone are joining Connect Care, which means that addiction and mental health services across Alberta are now all using Connect Care. Many pharmacy and diagnostic imaging sites in Edmonton, Calgary, and Central Zones are also part of Launch 6. There are some very cool facts about some of Connect Care's Launch 6 locations. Edmonton is home to the largest municipal park in Canada, known as the Ribbon of Green, measuring 7,284 hectares throughout the city. Every August-long weekend, Camrose hosts famous country singers at the annual Big Valley Jamboree Music Festival. The hit TV show The Last of Us has episodes filmed across many locations in Alberta. Familiar sights can be spotted in the show from Edmonton, Central, Calgary, and South Zones. Did you know there are roughly 4.5 million cows across the 5 zones, which surpasses the human population of 4.34 million? Lethbridge enjoys more than 320 days of bright sunshine each year, and they're the second windiest place in Canada next to St. John's, Newfoundland. During the Second World War, the town of Claresholm operated the Base 15 Flying School from June 1941 until March 1945. In August, Lamont hosts a family-friendly Babas and Borscht Ukrainian festival that features a borscht cook-off. Launch 6 includes close to 20,000 Connect Care users and 3,500 physicians and other healthcare providers, which means there are now close to 99,000 staff, physicians, and other providers across Alberta using Connect Care. Congratulations, Launch 6! You are changing healthcare for Albertans. Welcome to Connect Care.
Well, we have 3 leaders with us today who've been instrumental in making Connect Care a reality. Debbie Pinter, Clinical Operations Informatics Officer, Penny Ray, Chief Information Officer, and Dr. Jeremy Thiel, Chief Medical Information Officer. And they are joining us from various launch locations and wanted to give us a little hello and a couple of words. So Dr. Thiel, let's start with you. We're glad you're with us today and you're supporting teams this morning at the Misericordia Community Hospital. Do you want to say hi?
Thanks, Catherine, and good morning, everyone. Are you excited yet? Can you believe the years of work that have been in preparation to get you all here? And now we're just a few minutes away from officially launching Connect Care Launch 6. Just want to especially call out all the clinicians out there that are probably feeling a little bit nervous and excited at the same time. It's natural to feel a little bit apprehensive when you're starting a whole new way to provide care, but just want to reassure you, we are all there for you. The Connect Care team will be looking after you so that you can look after your patients. And you're going to discover as you join the Connect Care family just how incredible this system can be to help you provide excellent care. Thank you for being with us in this journey. And huge congratulations to you all for making it to this day.
Thanks so much, Jeremy. Penny, you're at the Rocky View General Hospital in Calgary. How are things there? There we go. Your room is on mute, so maybe I'll just see if Janine can unmute there.
Good, Dr. Rashan.
Yeah, we still have you on mute. Janine, are we able to unmute that?
No. They're going. It's just...
I'm so sorry, Penny. We're not able to hear you this morning. We can see you talking, and I know you have words of encouragement for the group. Maybe I'll just turn to Debbie, who's also at the Misericordia in Edmonton this morning with Jeremy. Do you want to say a couple of words, Debbie?
I just really want to say welcome. Welcome to the Connect Care family, Launch 6. 208 sites and over 23,000 employees are coming onto the system today at 5. Yay! Also want to just a special milestone for Covenant. Today we are going to bring up Grey Nuns and Misericordia and Villa Caritas. And that will be a total of 7 sites on Connect Care. So congratulations, because that's a huge accomplishment. And then maybe just lastly, in 3 out of the 5 zones, so Central, Calgary, and Edmonton, we will have acute, inpatient, and ambulatory on the system. So just hats off to everyone. Lots of hard work to get us here. So congratulations and enjoy your day. Have some fun and looking forward to working with you all.
Thank you so much, Debbie. And we are very pleased to be working with our partners at Covenant Health in a launch that includes, as you said, so many of their sites. As mentioned, Rosa Rudelich, Chief Operating Officer for Covenant Health, is here to mark this milestone today and offer some words of support. So Rosa, over to you for a second.
Hi, everyone. Thanks for the opportunity to say a few words of encouragement. Everyone here today and many others who aren't here have played an important role that has led us to this moment, working together so that we can provide better patient care to all Albertans. Your level of commitment and dedication has not gone unnoticed. We've heard how well you've been able to prepare. We're fortunate that the Connect Care team has taken advantage of learnings from previous launches to our benefit. However, launches have not been and will not be without challenges, given COVID and now the wildfire situation in Alberta. So we encourage you to remember what got you this far. Continue to support one another, lean on each other, look out for each other, take advantage of those around you. Celebrate your successes and share your stories. We can't wait to hear them. Thank you.
Thank you so much. We are also joined today by Sean Chilton, who's Vice President, Health Professions and Practice and Information Technology, and he's an executive director, or sorry, an executive co-sponsor of Connect Care. Sean is at the Misericordia in Edmonton. I'm not sure if you're on a screen or not, Sean, but welcome to the virtual celebration today, and thank you for joining us and the teams. And Dr. Francois Belanger is also with us early this morning, and he's Sean's counterpart as an executive co-sponsor, as well as AHS's Chief Medical Officer. Francois is joining us from the Rocky View General Hospital in Calgary, and I believe you wanted to say a few words as well, Dr. Belanger. Janine, he's in the RGH room 10331A, if you can unmute that one for us. Just one sec, Francois, we can't hear you yet, but we're gonna fix that. The room on the screen is called RGH.
Yeah, I've clicked on the ask to unmute, but I can't unmute you actually from here. So
There we go.
hopefully you can. Yep,
Yeah,
there you go.
Go ahead,
Can you
Francois.
hear me? Can you hear me?
Yeah,
We're
we can.
running out of time. I'm under the balloons here at the Walkie View. There's a lot of energy in the room, and just want to say big thank you to all of our staff and our physicians and the Connect Care team, the clinical operations team. Big thank you. It's because of you we can do this. Your dedication, your commitment, your compassion. That's why we can do this. Thank you so much, and good luck.
Thank you so much, Dr. Belanger. And now we are actually at the moment of launch that we've been waiting for after your months of hard work and preparation. So what we're going to do is make some noise and cheer and join together and applaud this launch. And we're going to turn our attention to that countdown clock, which is, well, it's already at 5 o'clock. I'm going to ask Charlotte to count us down to this official launch of launch 6 for Connect Care. So maybe Charlotte, if you can just give us a 10-second count, we'll join in with you as you count us officially into the next launch of Connect Care. So over to you, Charlotte, count us down.
We're unmuted. Let's go, guys. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Woohoo!
That would be an effect. It was, yes. Probably not the right season to do it right now.
Amazing, amazing. You guys did it. You got here.
Catherine, you're muted.
Oh, goodness. I knew I was going to do that once. Congratulations, launch 6. We made it. I want to welcome AHS President and CEO Mauro Kias to wrap up our launch event this morning and to offer some thoughts on this very important step for AHS. Mauro, thank you for joining us so early this morning.
Awesome. Thanks, Catherine. Thanks, everyone. No place I'd rather be at 5 in the morning here with all of you in this incredible launch. I want to echo Catherine's words of encouragement on the original stewards of the land that we're gathering here on, whose connection to this place has existed since time immemorial. So everyone, staff in previous launches have told me it can be a bit of a bumpy start, and we know that can happen, and it takes a little bit of time to get used to things. But once you guys are getting into the comfort of working in the system, others have said that they would never return back to the way of doing the old way. So have faith in yourself and don't be afraid to ask for help if you would have seen from people in the video. Historical day that we have so many people, over 99,000 users as a result of what we're doing. I wish you all the best. I want to say thanks to Covenant for coming along on this ride for us. This is going to be great to have the entire province united in this wonderful system that we call Connect Care and reap the benefits of what it's going to be able to do for our patients going forward. And lastly, but not least, a special shout out to everyone across the province right now, helping our patients deal with the wildfires that we're doing right now. As you probably heard, there are several evacuations that are going on. I'm sure half of the province is up today working and making sure and keeping our patients are safe. So shout out to them. Hope you guys are all doing well. And once again, wish everybody all the best. Thank you so much for your hard work to get us here to this launch, and congratulations.
Thank you so much, Mauro. Well, as we heard, you pulled together to make this happen. Your efforts have paid off and you are officially launched launch 6 in Connect Care. So congratulations to all of you. And thank you all for joining to celebrate your accomplishments today. We wish you all the best as you transition into Connect Care across launch 6. We're proud of you, and we know that you've got this. We wish you lots of energy today and safety to all of our colleagues across the province. Congratulations. Have a great day.